Good afternoon. This is Nancy Anderson from SMI, and I'd like to welcome you to this continuation of a series of huddle calls for SMI members during these very challenging times. As always, I'd like to start by saying thank you to all of you, both suppliers and providers who are on the front lines working so hard to help healthcare deal with this crisis. We are so very grateful for your hard work and dedication, and we thank you for sharing your very valuable time with us today. As in our previous calls, we understand that some of you may need to leave during the call, others may join as the call proceeds. We're very flexible. It's really just designed to be an open time for discussion, so you're welcome to stay as long as you can. These calls are really an opportunity for SMI members to share insights and ideas about the current crisis and work together to look for solutions we can all use to address the issues we're facing. And we're recording the calls, so you'll have access to them after the call. And we'll also be taking notes. And we have a location on our website where you can find all the notes and recordings from the previous huddle calls. On last week's huddle call, we heard from Jane Pleasance at Duke, Jeremy Strong at Rush University, and Steve Gunderson from BD. The notes and recording from that call are available on the SMI website. Next week, we're going to be featuring Marisa Faribaugh from Advent Health in Florida and Kurt Knopf from Spectrum Health in Michigan. And we'll be sending that invitation out on Monday. Christine?
Thanks, Nancy. So just a few housekeeping items before we get started. We currently have everyone on mute during our opening remarks, but once our speakers finish some brief comments, we will open the lines for discussion. And to participate verbally, you can raise your hand by clicking on the hand icon, and we will call on you and unmute your individual line. You can also type your questions into the question feature box or into the chat feature. We have a very big group on the call today, so if we don't get to your question during the call, we'll send you a response after the webinar is over. Nancy?
Thank you, Christine. Without any further delay, I'd like to introduce Curtis Lancaster from Dartmouth-Hitchcock Health in New Hampshire. Curtis is joining us today, as well as Charlie Miceli, who will be joining us as soon as he finishes a previous call that he is on from University of Vermont. Curtis and Charlie both lead the supply chain for their organization, and they are also going to be joined today by Casey Spiegel, who's the CEO of Transborder Global Freight, and Earl Ralphs, who's the CEO of Medique USA. Both Casey and Earl have been instrumental in the response to the virus and the emergency that Charlie and Curtis have put together. So thank you for joining us today. And Curtis, I'd like to start by asking you just to share some insights on how you've been managing through this crisis at Dartmouth-Hitchcock.
Thank you, Nancy. It's, I think I speak for all the supply chain professionals in that we have been facing this with our teams. It's kind of an unprecedented time for all of us where there's this massive once-in-a-century disruption in our supply chain, and trying to get the product that we need to be able to keep our communities, our patients, and our staff safe has really been the number one focus for all of us. Whether we have people working from home or people that are working at the hospitals or warehouses that we may have. Ours has been a strong team effort, whether it's our folks that have been in incident command and have been at the sort of the forefront of all of the activity that's going on, or our sourcing team, or our operations and logistics team, and just the tight communication that's been going on has been really what's kept us going. Early on, we recognized, that going through our known suppliers and distributors was not going to suffice as the call for the PPE that we might need started to ramp up. We had to get creative and go into other avenues that we might not normally go to get product. And we also quickly partnered with the University of Vermont Health Network. Charlie and I had been working together over the last couple of years. This drew us together very closely and very quickly. We ended up having a daily call with the two health systems, the leaders from the two health systems, supply chains, where we would divvy up the work, whether that work was go out to manufacturing and see if somebody can make a face shield, go out to distilleries and see if people can manufacture hand sanitizer for us, or if it was to chase down the multitude of leads that I'm sure all of us got via email or through connections that either employees at the organizations or community had provided to us. So it was coordinating the different activity and then checking back on a daily basis where we were on our progress.
Excellent. And I know you did some creative things. I don't see Casey and Earl on the line yet, Curtis, but perhaps you can give us an overview of the creative work that you and Charlie did with both of those resources.
Yes. Our laundry, our joint laundry, both University of Vermont Health Network and Dartmouth-Hitchcock Health, use Medique Blanchel. It's a laundry that happens to be in Canada, Montreal, Canada. So immediately we recognized that there was the potential for disruption on crossing the border. We engaged, probably like most of the organizations did, with their government relations team. And our senators helped ink all the senators that were on the border states, the northern border with Canada, all inked a letter to the president urging him to keep the border open for, healthcare type products, because we know for us coming through the Vermont border was a key component for us. Earl, who leads the American version or the American side for Medique, he has a background in sourcing and manufacturing. And so he was able, or has been able, to source products from China and bring them into Canada. And then we bring them across into the US. And that's been very helpful for us, avoiding airports like JFK and some others that get very, very congested. So joining in with that government relations and partnering with somebody, he's our laundry, the CEO of the laundry, and not somebody you would traditionally go to as a trusted partner to get you product, but he's got us everything from face shields, goggles, isolation gowns, and 95 masks, and he's actually successfully got us the product, which has been nice. The Trans-Border Group really has been a godsend for us. What they do is they are a logistics company that does international business, air freight. And so when we would have the different various orders that were out across the world, and we gave the information to them and the responsibility to handle the logistics for us, not necessarily the air freight, but just the logistics. And so we get daily emails from them updating us on all of the different shipments. So we'll find out that shipment for PO number 12345, which is face shields, has now arrived at its origin airport. Then we get an alert later saying that paperwork has been completed, awaiting air freight booking. Then we get an alert which air freight it's been booked on and what the flight numbers are. So we have this transparency of where all of our shipments are, where early on, we would either issue a PO or in some cases wire money and not have a lot of visibility into where the product was. So it's been an incredible help to us to be able to have somebody that can provide that information all along the sort of the logistics journey of the product.
That's wonderful. It looks like Casey is on the line, and I just got word from Charlie, Curtis, that Charlie will be joining us momentarily, so you'll have a partner in crime. Was there anything specific you wanted Casey to share with the group?
Yes, Casey, thanks for joining. This is Curtis. I was hoping you'd be able to give
we're going to need to unmute him. So go ahead, but while you're talking, we're going to unmute Casey so he's ready to speak.
All right. So Casey, if you just want to give a brief overview of the company and sort of the different activity that you've been doing for us, and how that might be unique for you getting into the healthcare space would be valuable.
Thank you, Curtis. Well, I'm fourth generation in this business, and we've seen a lot of changes throughout the world in different times and different products. But unfortunately, today's world, the last 2 or 3 months in logistics for healthcare specifically, there's been tons of challenges, and most specifically out of China. So we've seen delays from the Chinese government. We've seen them from the Chinese suppliers. We've seen rule changes and documentary changes and requirements from Chinese customs sort of on the fly. So I know that you guys have had some shipments come into the port, for example, and overnight while they're at the port have documentary changes and requirements from Chinese customs to allow the export to happen. And because of that, we've had to pull the product back out of the ports. Manufacturers have had to repackage it, recertify it, create different document sets, and then we rebook and sometimes have to reroute that shipment to get it back to you in a timely fashion too. So we've also seen pricing go through the roof for shipments most specifically from China to the United States and Canada, which is unfortunate at this time. But you know, we're seeing pricing that's 4 and 5 times more than what it should be.
Casey, can you just real quick, the rule changes you were talking about, I know that was one thing that really caught us by surprise is, you know, we heard, oh, the product's at the airport, and we had anticipated, you know, tracking our continuity of supply and what we expected to be flowing in for our hospitals to all of a sudden be altered when, you know, there's 1 million procedure masks that all of a sudden have to be pulled back to either be new paperwork or new boxing. And so having a logistics partner able to communicate to that, because otherwise we were blind to that. How do you think that really impacted those shipments? I'm assuming it's not just us and our shipments that were like that. Does that impact the congestion at the shipping sites? How does that impact?
If I could, I'll bring it back probably one more step too. In a normal course of business for a transaction in China or anywhere in the world for that matter, when you call my company Transborder and say, I'm going to have this shipment, it's this big, it'll be ready on this date, I can typically book it and tell you what the pricing will be right away. And now we can't do that in China because the Chinese airlines won't allow any bookings to happen until the cargo is at the airport and cleared export control. So there's customs on 2 sides. Product has to be cleared from Chinese customs to be exported and then cleared by US customs to be imported into the US or Canadian customs to go into Canada. So what happens now, we get the product at our offices in China. The inspection happens for export control. In the meantime, they've been making some changes, sometimes overnight, sometimes during the same day that cargo's arrived at the airport. And the manufacturers or the suppliers have had to pull the cargo back. Sometimes they have to repackage it. In the latest case, they've been pulling off FDA and CE markings on the boxes. The government has also made it mandatory that companies be included on a white sheet. That white sheet that they call it is a list of manufacturers that are approved and manufacturing facilities that are approved to export PPE product out of China. And if you're not on that list, the product doesn't move, gets seized by Chinese customs. So those are the types of things that your suppliers have been dealing with, and it's not really a piece that we can change because Chinese customs is driving those changes, and it's not really the fault of any of your suppliers either because they're doing things in a compliant way, and then sometimes it takes 2 days, 3 days, maybe even 4 days for product to cross China in trucks and get to these airports, and by the time the cargo arrives, there's new rules in place. It's really been difficult to hit several moving targets, including what Chinese customs is requiring to export, pricing with your suppliers, and then pricing for air freight. And now we're getting to the point where we're catching up with some of the air freight and or getting ahead with the air freight. So we're starting to supplement with some ocean containers as well. But we're seeing that Chinese customs, the same organization that's handling the airports and the ocean ports, are handling those ports in a very different way and approving different types of documents and markings on boxes. And that's been challenging too, because there's no continuity there.
All right. Thank you very much, Casey.
Thank you.
This is Nancy. I was talking away and I was on mute, so please accept my apologies. Charlie, it sounds like you've joined the call and we'd like to welcome you. Charlie, are you there? You show him on the call. We're having
Maybe
a little
he's
trouble
muted.
with your, doesn't look like it. Well, anyway, thank you very much, Casey. And Christine, do we want to open it up at this point for some questions from the audience while we wait for Charlie to get onto the call?
Sure. I don't see anyone with a question. We haven't had any questions via the chat feature or the questions feature right now, Nancy. So I will put the instruction sheet up so people can, if you want to ask a question.
Nancy, during that time, if we could pivot just a little bit to recovery.
Absolutely, that would be great.
So, you know, as we continue, we in New Hampshire have not hit our peak.
Hi, this is Charlie. Did I make it in?
Charlie, you're in. We got you. Thank you. Curtis was just going to begin. Curtis was just going to talk about recovery a little bit, and then we'll turn it over to you for some comments as well.
Yeah. Oh, thanks. Okay.
So we, you know, we're still in our waiting for our peak to hit. So we're still in making sure that we have the adequate number of PPE. But as we're preparing for recovery, as I'm sure everybody else is beginning to either do that or in the planning stages, it's quite a moving target. You know, we don't know, you know, once we put the doors open, if the patients are going to come or if they're going to be nervous about the virus. So we don't know exactly what the volume is going to be. And then the different PPE by different clinical environment is also varied. And one of the big concerns is, you know, once we've got the PPE as locked down and dialed in as we possibly can, what's the next shortage that's going to hit? Because as everybody ramps up at the same time, the manufacturers who have diverted capability to all manufacture masks are now going to be behind, whether it's isolation gowns or one of the ones that people are chasing. But what's next after that? And if a piece of radiology equipment goes down and you need a repair part, has the factory that manufactures those parts been closed due to lockdown and been able to get that over to the U.S. so that you can get your equipment up and running? So it's what's next. I think it's that unknown as we go into that recovery that's going to be extremely difficult. And so partnering very closely with your clinical operation, your operations team in IC to know what their PPE expectation consumption is and where they're expecting to ramp up in what service lines, what areas, so that we make sure that we don't have a shortage in advance. That's what we're doing right now to make sure that we're staying as abreast or ahead of it as we can.
Excellent. Yeah, and SMI is doing a little bit of work. Curtis, you and I were talking a little bit before the call, but we're going to be sending out a survey on Monday to provider members, asking them for some insight, some very basic insight on how they expect to begin ramping up for elective surgeries. And we're going to be sharing that information and then also turning it into more of a tool that's going to be available for the industry. So everyone can look for that tool on Monday. Charlie, welcome to the call. We're glad you were able to join us today. And, you know, Curtis has given us some insight into all the work that you're doing with Transborder, Global Freight, and Medique. I'd also like to get your perspective on just what's going on at University of Vermont, how you're managing, and what some of your biggest challenges have been so far.
Well, yeah, thanks, Nancy and folks. From our perspective, it's been almost, you know, back to the future for me, having come out of manufacturing almost 40 years ago, and then having to, you know, go old school again and go from, you know, a pretty successful continuity of supply with distributors, you know, mostly indirect management. I mean, we never really watched manufacturing rates or anything like that, or raw materials. and to go into a disintermediated process to establish supply lines that were basically destroyed. And I can tell you that, you know, our alignment with Dartmouth was the first step. And Curtis, I think we started that in February, maybe mid-February, where we placed an order for surgeon gowns, anticipating that there was going to be some type of disruption in the supply chain, but it was going to impact our ability to get material. And we wanted to protect our procedure volumes and stuff so we didn't run out. And basically that got turned around where all the procedure went away. But it was the initial effort that got us working together. And when, you know, things started to light up after we had our quarterly business review with our partner Medline on February 26th, and, you know, they were great. They said, yeah, there's going to be disruption, stuff's coming over the water, that's okay. But, you know, Wuhan's lit up. That's where a lot of the manufacturing is. And they started helping us, you know, look at our allocations and stuff like that. But then we knew at that point in time that we really needed to take a look and see what else we could do. So we had to set up, we already had a pretty good, you know, pandemic from H1N1 and Ebola process in place. But the known unknowns that attacked us, you know, in the subsequent weeks after the beginning of March, never saw anything like it. And as we got tighter with Dartmouth, mid-March, actually I know the date, it was March 23rd or March 22nd, I got an email from one of the doctors over at one of our hospitals in northern New York and said, hey, I know a guy, one of the doctors that has someone that may be able to get material out of China. And I said, oh, that's good. So I'll talk to him. And that was Casey, who just gave the talk about from Transborder Global Freight Systems. And we had our first conversation, I think, about 7:30 in the morning on March 23rd. And it's been a 7:30 call every single day. And between the Dartmouth Alliance, as we order together on any type of PPE, that's a group order. We meet every single day. We've actually went to once a week now, starting this week, because we knew we were going to have this today. But we met every day of the week, Monday through Friday at 5:15. We had chief operating officers from each respective organization. We've had Transglobal or Transborder Global on our call. Medique Blanchel, who's our supplier for linen that takes care of linen for Dartmouth as well as the University of Vermont Health Network. They're about, 63 miles away from us across the border in Canada. Our first fright was when the borders were going to get shut down and they weren't going to allow traffic to go back and forth, because I think Trudeau, Justin, and Donald weren't getting along. So we had to activate our government relations folks to ensure that we had safe passage of our linen. You know, from my experience, you can run a hospital without IV solutions. You can run you can run a lot of operations without supply. You can't really run a hospital without linen. So that was our first big red light that we had. And then we started sourcing through our contacts, and our CEO at University of Vermont Health Network, Dr. Brumstead, he's batting 1,000 on referrals. He had a legislator call him and say, hey, I know these guys that have a kombucha factory that have excess ethanol. Do you want to do something with it? So he gives it to me. I contacted one of our board members who ran, was the CFO for I can't think of the name of it, a rye whiskey company, and then had a Stonecutter Spirits. And I said, I don't have time to handle this. Can you take it? And 5,000 16-ounce bottles later of hand sanitizer and 10 55-gallon drums of Vermont Strong hand sanitizer came out of that. Another person was the ex-CEO of Vermont Teddy Bear, had a bicycle apparel company. They connected with we connected with them, and they were able to get us 1 million face masks, procedure masks. Same thing with Concept 2, which makes fitness equipment, and in Vermont, all of their manufacturing got shut down, and with the stay away from work, they donated 500,000 procedure masks, and then also supported the state of Vermont for another couple million masks to come in to help us out. And now we're using their supplier that they use for gowns, ISO gowns. So it was really interesting. We went from this integrated work through the distribution channel, running like a top or pretty close to a top, to this major disruption. And we went old school. Unfortunately, China's 12 hours ahead, so you kind of work a longer work day to make your contacts. But I can tell you from the teamwork and the alignment that we were able to establish, I'll always remember that. And Curtis, did you talk about the Aqaba?
No, not yet.
Yeah. So Nancy, can I talk about that real quick? Because that kind of puts a bow around what we did organizationally. Is that okay?
That'd be great. And I think Christine has the slide for that, right, Christine?
Yeah. So I'm going to go back in the time machine to, and this is kind of surreal too. You go back to 2001. I was actually working for Tom Hughes at BD Healthcare Consulting and Services, and after 9/11, I had to quit flying 250,000 miles a year, and got a job back at Partners Healthcare System at Newton Wellesley Hospital. Newton Wellesley Hospital had lost $1 million a month for 54 months in a row, but they had good cash reserves. And so Dr. Mike Jelnick, who was second in command of the Mass General, and Pat Jordan, who was the head of radiology at the Mass General, went in as CEO and COO, and we started a turnaround. Joel Polsky, who was with me, Pat, and Dr. Jelnick at Newton Wellesley, is now at Dartmouth working with Curtis. And Pat Jordan is the COO of Dartmouth. So, who would have thought, 18 years down the road, we'd all be working together again, fighting another thing to overcome. So back in 2001, 2002, Dr. Jelnick was a big fan of Lawrence of Arabia movie. And if you remember Lawrence of Arabia, the Turks had Aqaba, which is now Jordan, had this big, they were on the sea. The only way you could potentially attack them were from the water. They could train their guns down on you, and you were Swiss cheese. So Peter O'Toole and Anthony Quinn figured out, if we can go 600 miles across barren desert, they'll never think we could do that, and we'll take them. Well, that's what happened. They took an impossible mission, made it possible, and it changed it solidified the Allies' lines and supply lines and war lines in World War I. So we called it Aqaba by land. So as we congealed with the University of Vermont Health Network, Medic USA, Dartmouth-Hitchcock, the state of Vermont, Transborder Global Freight, and our friends in the Vermont National Guard, which are the Army and the Air Force, we have 16 F-35s here, and didn't have to use them for anything yet. But we put this together, got sanctioned by Pat Jordan, who's the COO of Dartmouth, to call this Aqaba by Land 2, and that's our mission statement. And we've rallied around that. We've added the suppliers that have got us through, and we'll probably put a couple more on the board. But this was our battle point, and this is how we move forward. And we couldn't have done it, I don't think, without information, without a mission. My job changed. I report into the military, my group, as well as the state of Vermont. We got waivers, so we actually do the purchasing on med surg supplies for the state of Vermont. And everything, we all share the funding, and tracking that's hard to do because we're all in different systems, but it's worked out very well. And again, what Curtis was talking, but that's what I want to say about that. So we made the team. We saw we were in the red zone, for probably 3 weeks. I couldn't even talk to even participate on this from March 20th through, the second week of April. It was that brutal, and I'm sure it was for all the folks on the call too, that it was that tough. But supply chain folks, from my perspective, are pretty resilient. We've went through the AIDS crisis, we went through H1N1, we went through Ebola, we went through all the hurricanes. Mike Louvier's folks down at Oshner, they had the Cajun Navy down there. They got their own Navy. So, what we can do and what we can roll, I think is very good. And I'm honored that, I can represent all of our folks that are listening on this call from Dartmouth, UVM, Transborder, Medic, and the U.S. military for getting together. And I'm sure you guys across the country have the same stories. But from the trenches, we're still in the freaking trenches. We're going to go back in on the recovery. That's what's going to be tough. So that's all I have to say about that. And if anybody, Nancy, I'll stop. I can keep going on this. It's so exciting.
Oh, thank you, Charlie. It's great to hear your stories and hear about all the wonderful things you guys have accomplished with all this amazing collaboration and teamwork. I think we do have a couple of questions from the audience. So Christine, I wanted to hand it over to you for the questions.
Okay, thanks, Nancy. We do have one question regarding shipments from China. So the question is, how much do you think the challenges with shipments from China has been driven by supply and demand versus trade relations? And that includes both pricing and rule changes.
I'll take the first stab at that because when we get our freight bill from Transborder, it's a big number, but it's a righteous number. The challenge to me has been the rule changes. There's always going to be a cost to do business and to move stuff by air, and so having a company of high integrity that you can trust is number one. Number two, we had the FDA changed rules, CDC changed protocols, the U.S. government changed rules, and as I heard Casey talking about the packaging changes. We had 2 million masks coming our way, or 1 million KN95 masks coming our way that we saw the video. It said CE and FDA on the box. And a week before when we saw it, it was fine. And then last week I was like, oh shit, this is bad because the Chinese aren't letting that stuff through. So they have to redact and repack several times. And I know Casey talked about that, but Casey, are you on to elaborate on the cost structure and the challenges for what you see? Because you do this all day long.
I am, Charlie, thanks. So what you just talked about is obviously increasing cost on the product side, and on the air freight and ocean freight side at this point, we're seeing that rates have just been climbing daily, and it's very hard to narrow down what a shipment's going to cost you and give you that number up front. And I know you've come to accept that, and it's unfortunate. I did see today per kilo rates went up twice, from China to New York and China to Toronto. So it makes it very hard to plan or budget on your side. I know that. For us, obviously.
That's another thing. Yeah, that's another thing too, is we rerouted several shipments. So now we come through Canada. We have some influence on the border because with the Army and the state police and and working with customs and the Canadian folks, Canadian is Vermont's largest trading partner. So we have a great relationship. So I think, Casey, almost 100% of what we're doing now is it comes into Montreal or Toronto, then to Montreal, and then you bring it over to us. Is that correct?
Yeah, we have it booked actually straight through to Montreal, but we're flying it into Toronto, moving it in bond, and then making an import on the U.S. border.
And this is Curtis. One thing that we heard early on is that the airports and the ports and the customs over in China were full, and that's what the holdup was, that it was a massive amount of product all trying to be fit into a finite number of shipping positions. And while I believe that's true, having Casey's team give us the information on the sometimes daily changes of the rules, and the inspection of the product that wasn't there early on, and then what can and cannot be on the paperwork or on the box. I think at the beginning there was a bit of the first, it was supply and demand, but it's definitely shifted to more of, and I don't know if it's political or what, but it's shifted more on the requirement side. We wouldn't have done that, I think, without a strong partner.
Yeah, and the other thing is that we've been working with Medique Blanchel, and a laundry company, and been a long partner of the University of Vermont since I think 15 or 16 years, or longer than that, maybe 20 years. And we've only had one time when a shipment got stuck, and it was because an isotope was in the laundry, and Homeland Security stopped it. But the trucks made it across the border at 9/11. They were the only vehicles that made it when we shut the borders on 9/11. The University of Vermont, or Fletcher Allen at the time, got their linen processed at the time. But the other thing that what was really interesting to me, and which I'll always remember, is the way that Medique Blanchel, under Earl Ralph's leadership, they changed it. They're our highest purchase supplier and being able to source. We linked them up with Transborder, and those guys are dynamos, watching commodities, negotiating for us, and securing product for us. We just brought in, for the state, for Dartmouth and UVM Health Network, in the last 3 days, we've bought in almost 4 million masks. So we're sitting okay right now on masks. The next shiny ball to chase is gowns, but we're lucky because we have somebody that with laundry experience, and Earl, I don't know if he can get on the call, but he was a Baxter American Hospital Supply leader before moving into that. So we have the innate knowledge of fabrics, processing, sterility, etc. And one of the things we're doing is we're getting away from this. We're moving as much as we can to reusable everything, so we don't get in this crapshoot again. And pay $5 for a thing that costs 60 cents. Becker's had it right last week, 1,000% markup on a lot of stuff. Just but it's the market. It is what it is. So that's what I have to say. Hopefully we answered that question.
Thank you. I think you did. Thank you very much, Charlie and Curtis, and Casey as well. I've got a question for you guys about and Curtis, you had covered this a little bit earlier, about the recovery phase, and the idea that, at some point soon we're going to start moving into that phase. I think different times at different points in the country. But we're thinking at SMI, and would love your thoughts about how SMI and our members can lead the industry as we move into the recovery phase of the crisis. What thoughts do you have on how SMI can help facilitate that recovery phase? Charlie or Curtis?
Well, I'll go first. Stab at it.
Go ahead, Curtis. Go, Curtis. Go.
One of the unique aspects of SMI, and I think one of the big differentiating factors that makes it so valuable and unique, is the pairing and the partnership of the providers and the suppliers. And so, the suppliers have been very, very good at this point of, sitting in support and waiting for us to reach out. We need them, but this would be a time for them to maybe start reaching out a little bit more proactively to us on what their capabilities are and how they can help us in the recovery effort, because we have to inform the different areas, whether it's going to be an orthopedic procedure or cardiology procedures, but to be able to get the partnership with them early on, and maybe it's in these types of forums where we'll be able to communicate the needs we have, and they'll be able to communicate back some of the help that they're able to do.
Charlie, your thoughts?
I mean, we have the cream of the crop in supply chain at SMI, way back when it started, and then just the current cadre of leaders that are there, not only from the provider side, but from the supplier side. And one of the things is we can do business in the sense of trying to make everything better. And I think having that transparency and those relationships, where you can sit with leaders from Medtronic, Cardinal, BD, I can go down the line of any company, Medline, et cetera, as we sit down and try to solve problems together, having those forums, and like with having HIDA that John Leibowitz was running, for us. And I felt really bad that I had to drop off of that over the last few weeks, because we had some really cool stuff going. And but now we got thinking time. But I think this is where, when we start up the recovery, how can we band together and influence and share what's happening every place. I think it's great. I just saw an email from Smith and Nephew and a couple other companies. I don't know if they're listening in, but it's great because I see them at SMI and we catch up. And I think having the talks like this, Nancy, and maybe some focused forums with interrogatories ahead of time that SMI could then collate, and then we have them for discussion. That'd be really cool, because I think we need that. It's just from not even from an operations standpoint, but just to a collegiality standpoint, and because you don't know what you don't know, what everybody's going through. And I don't know how many other people are working with the military or working with their government. That was totally different to me, and hadn't done that before. So, my wife says, yeah, now you finally got to play Army after all these years. So.
Well, and Charlie, thank you for that setup, because SMI is in the process of planning our spring virtual forum. We are converting to a virtual platform, and we are developing ways for members to share insights in a way that will help us drive forward to creating new tools and new initiatives to really help with the recovery phase. So our members, watch your email. I think you should have seen a link to the new SMI virtual forum website that came out in Quick Bites yesterday. And end of next week, you should be seeing the actual registration information, assuming that we're able to move forward in the timing that we think we will, because we're really sensitive to everyone's availability. Most of the events will be members only, and then members can invite, like they've been able to this call, we'll be able to invite members of their staff to specific sessions, more the general sessions. But we're hoping that we can really use the online and virtual technology to its best advantage to drive networking and great conversations. So thank you for that setup, Charlie. And I even though I didn't pay you for it, people are going to think I did. But thank you very much.
And this is the first day I've actually got to look at stuff, so I didn't even know you guys were doing that. So, but It's so, I expect you guys to do that because of the organization, and I expect all of us to participate, because that's the way we're going to get through this shitstorm. So, I cherish the time that we have on calls like this and the SMI forums. They're the best ones that I participate in. So, it's great.
Thank you, Charlie. I think, Christine, we've got a question from the audience.
We do. Eric Berger from Leahy. Eric, do you have a question?
Sure. So, Charlie and Curtis, how do you guys see the supply chain relationship between your organizations evolving as we get past this crisis? And, because I think there's an opportunity to take a step back and go, well, hell, do I need a distributor? Should I ever be involved in a low unit of measure program ever again? Or, are there opportunities to do a consolidated service center? And you guys have started from the sourcing perspective, but are there other plans, beyond the immediate crisis to expand the work that you're doing?
Yeah, I mean, at the end of Eric, and full disclosure, Eric used to work with us too. So, and he's a military guy too. So, and a kick-ass supply chain guy. You hit it right on the freaking button, man. You know, we have to start working together, even though in some instances we're competitors. But when you do the supply chain stuff together, that lowers the cost curve if you do it the right way. And we're in active discussions to leverage. We're fortunate at University of Vermont Health Network. We were gifted, 180,000 square foot camp service center that we've actually, activated for this. And we've had Dartmouth at our side.
Sort of already had that relationship, and the teams, the individual directors and managers had met with each other as well. So we already had a camaraderie before this started, which made our collaboration much easier.
And Curtis and I had a weekly meeting. We're going to join the North New England Alliance for Health. We just didn't do it because this thing blew up. We would have already been lined up as a member with that LLC as a start, and we wanted to potentially expand that too. So.
Great. Any other comments on that question, Charlie or Curtis?
None from me.
I wanted to address a question that Denise Downing posed, and she was recommending that SMI collate all these wonderful experiences that you're talking about so that we can share them as a tool for others in the industry. And Denise and others, we are actually taking detailed notes and recording these sessions, and they are all posted for the public on SMI's website. So we have a new toolkit. So we have a COVID-19 resource center on our website, which is resources from outside organizations, RM and HIDDLE, and all sorts of resources from outside organizations. And then we have a COVID-19 toolkit, and within that toolkit, there are the recordings and all of the notes from each one of our huddle calls, and the recording and the notes from today's huddle call will be uploaded to that site on Monday as well. So thanks for the suggestion, Denise. I think we're gathering them, and then we're going to continue to look for ways to use all this great information that we're collecting as we go forward into the recovery phase. Charlie and Curtis, how are your teams doing, and what techniques and tools and resources have you been using to help them cope with this crisis?
Fear,
Fear. That comes automatically. You don't even have to create that, right?
So Nancy,
Curtis, why don't you take the first shot, then I'll do the second. Yeah.
Yeah. One of the unique aspects, I think, speaking for all of the supply chain leaders, is you try to surround yourself with talented people, and in situations like these, the cream will rise to the top because it's an unknown, and people take on additional roles and doing unique things, whether it's partnering with a local manufacturing firm like Fujifilm that we had and making a face mask, and so I think by their nature, the people who have found themselves in a leadership position and worked themselves to that position are self-motivating. They are go-getters. And, if you ask them, hey, is there anything you need? Do you need to take some time away? To a person, they're going to say no. And, I'll speak for my team. I'm sure Charlie's is the same. That's been the experience I've had. Do you guys need to take a step back? How are you doing? And each and every one of them is, give me more, give me more. It's energizing to be able to help and to be able to do things in a unique way and sort of flex their supply chain muscles to be able to help the system and the community.
Yeah, and I'll double that remark too. Like this week, I'm the administrator on call for the medical center, and I was the administrator on call for 2 weeks when this thing lit up, plus doing my regular duties at the network. But I did not participate in incident command. My second in command was the logistics chief in incident command, and I had complete 1,000% trust. I had 1,000% trust in every one of my staff that report into me. That we have a daily 15-minute that we hit most of the time, Skype. And the first question that you ask is, how's everybody doing? And can we help? And, like Curtis said, everybody wants to help, wants to run with stuff. We stood up a 400 bed and a 100 bed auxiliary hospital with the military in very short suspense periods, very successfully. It was a fire drill, but one of the things that we did is I told some of the leaders, you have a forced 1 hour, ditch the iPhone, ditch the computer, and get away. And during the day, and you have to do that because you lose it, and it's battle fatigue, and it's moral injury. It's moral injury if you don't take care of that. So, but yeah, I same thing. Taking care of the troops, making sure everybody. You have to give everybody something to do too, and it was hard in the beginning because you were kind of trying to figure out where are we going to go. It's going to be more intense now as we start working with our suppliers to reactivate, finding out what are the supplier rules of engagement. Can a Medtronic or a Smith & Nephew or a Stryker or a Synthes, can they come on site now? I don't know. Because are there companies letting them do that? And so we started that database and that process just to say, these guys are our suppliers, are our partners that work with us day in and day out. And, we fight over money and terms and conditions and all that stuff. So that's a basic business thing. But at the end of the day, we're holding hands, taking care of the patients and taking care of each other. And we're so blessed in the sense of SMI to bring us together to even, to make that statement. And that's heartfelt and true. So, I think you just have to take care of each other to go through the hard times. And we got some hard times coming up. And then who knows, we may have round 2 of this thing too. So,
yeah.
And Nancy, just one more comment on that.
Sure.
We call ourselves supply chain, and we are a supply chain, but we're also a people chain. And, whether it's within our own teams, the people that we have that are linked together to be able to accomplish this. And then we sort of expand that to, like in our case, the 2 health systems working together, and then the different provider partners or community members that have helped. So as much as we are supply chains, we're also people chains.
Yeah.
It's a great way to look at it, Curtis. I love that. Excellent. Well, we've got just a few minutes left in this session today, and I know everyone has really appreciated all of your insights and all the things they've had to learn from you through this process. Thank you so much. Do you all have any final comments? What would you like to have people take away from this call in terms of sort of the biggest thing you've learned from this crisis? Curtis?
Well, I would say just the creativity and the ability to move quickly. I guess the agility of the supply chains, and the importance. And I think Charlie said it very, very well of trust. Whether it's trust in your team, or trust in your logistics partner, trust in the providers that are bringing you stuff. You need to have that trust. Creativity and trust, I think, are the 2 things that have popped up to me as the most interesting and important.
What about you, Charlie?
From my perspective, trust and risk assess, but make sure your chain of command has got your back. And I've been fortunate. I know we've both been fortunate to have that, and to embrace your staff and make sure that they're all good, because it's colloquialism, but you're only as good as your weakest link, and you have to accentuate the levels of skill sets that everybody has. Critical thinking's important, documentation's important. You got to keep the accountants happy, and just to be able to explain in simple in simple language to the CFOs. This was the hardest part, transaction wise. Why do we have to pay these guys money up front? Well, a purchase order doesn't mean anything in China. So, and if you work escrow, you do different, and we're seeing some things relax now, which is good. But in the beginning, I hadn't done a wire transfer since I bought my house. So, it's just a different way of doing business, and just never say never. Because I never thought we'd talk with Dartmouth about getting together, doing anything, because we're competitors. But, at the end of the day, in 2013, we formed One Care Vermont, which is a ACO. I served as the CIO. It's Dartmouth and University of Vermont Health Network own it. So we showed that you can compete, but still, work together to take care of the patients. And we take care of a few million people between New Hampshire, Vermont, and New York. So all said, it's teamwork, trust, and, take care of each other.
Wonderful. Well, thank you. We're coming to the end of our call. I really appreciate Charlie and Curtis, your being on the call, and Casey, you as well, sharing some insights from your perspective. Charlie and Curtis, your creativity and your dedication to the work and your leadership is really inspiring, and we thank you for sharing your thoughts with us today. We look forward to seeing everyone or hearing everyone on next week's Huddle call, and please do watch your email for the information on the upcoming SMI virtual forum. Thank you so much for participating today, everyone. Again, thanks to Curtis and Charlie, and we hope you all have a safe and healthy evening.
Thanks, Nancy.
Thank you.